Hello, Zoltan here from Adagio Hands Releasing Stuck Bodies. In this video, we're looking at the protocol for treating minor musculoskeletal injuries. So this is the kind of thing that you may not want to go to the GP with, you may not immediately want to go to a manual therapist with, but maybe you've been out for an exercise and you feel you've pulled a muscle, it feels tender, or maybe after exercise, or even you just got up in the morning and the joint feels painful, it feels inflamed. And the protocol we're going to look at is RICE, rest, ice, compression, elevation. Now, this is a well-known protocol. It has been developed over the years, and these things are continuously discussed and researched and refined. So RICE, I believe, became POLICE, P-O-L-I-C-E, and then it was further expanded to Love and Peace, if you can make out what that stands for. But RICE is still the core protocol that's used by the NHS, and I'll qualify each of those elements and add some further considerations at the end. So R, rest. If the muscle feels tender, if you know you've pulled it, if that joint feels painful, then don't yank it around, don't overload it, don't cause yourself more pain. But do keep moving as much as you can. Keep moving in the rest of your body to ensure that that doesn't suffer and that doesn't go downhill. Keep moving in the rest of your body so that nutritional and fluids keep moving to the injured area and that the tissues keep gliding and moving things along. Even the injured area, you can move as much as you can to the point of pain. Obviously, don't move it into extreme pain, because pain is a signal that you don't want to do something, but to the point of pain, absolutely. So gently feel for what's going on there and feel how much you can move it, how much you can use it without overloading it, without going into pain. So that's the rest, the qualified rest. Next, we have ice. So icing an area, whether it's a joint or a muscle, can be great for reducing pain, reducing swelling, reducing inflammation. But the thinking over recent years has been, well, hang on. The inflammatory response to injury is something that our bodies have developed and refined over millions of years. So why would we want to dampen that response? And in fact, studies show that reducing inflammation does reduce the amount of materials that go in to protect and heal the area. So that's not what we want, is it? And yet those other benefits of ice, of reducing swelling, of reducing pain, can have a benefit. Obviously, in extreme pain, you have the choice of maybe taking a painkiller, with anti-inflammatory, or applying ice. Which one are you going to do? Do you want to take a pill, or do you want to apply something that perhaps feels a bit more natural? The other element of this is pain doesn't exist in isolation. So if you're in pain, chances are the surrounding tissues and muscles will be constricting, maybe spasming, and that will then cause further aggravation of the area. So simply by reducing the pain by icing, you may relax the area, and that will reduce the aggravation. And if you reduce the aggravation, then that will help reduce the inflammatory response that actually is no longer needed, because there's no longer any self-aggravation. So do you see that ice can be both inhibiting inflammation, but it can also help reduce the cause, the need for that inflammation? And it's a judgment. How much pain are you in? How much is that swelling? Because again, if that swelling is going into another area and pushing on another area, that's also going to be causing aggravation, and we want to reduce the aggravation as much as possible. So it's a judgment call on when you apply ice, but if you're in pain, if there's big swelling, chances are it will do you some good and help your system recover in a more, I'm going to use the word holistic way. Now, how do you apply ice? Well, there's various Timescales for this: absolutely do not apply ice for more than 20 minutes and then wait for 40 minutes before applying it again. Those are the outer limits. Now, personally, I think 20 minutes is quite a long time to be applying ice. You need to stay still. It's a kind of tense situation. I'd say apply it for a few minutes and then have some ice off, allow the blood flow to come in again, and then 10 minutes later apply it, ice again, 2 to 5 minutes, and then off. And after that you'll probably get bored with it anyway, but see how you go. But important is, after applying for a few minutes, take it off and wait 10-20 minutes before reapplying, so you get that blood flow returning and you don't get too cold in the area. The other element when you're applying ice is it's preferable to put the ice into something, so maybe into some material, and that's to avoid the ice kind of freezing onto the tissue. And also, when you're applying the ice, try to apply it onto soft tissue, not directly onto bone where there's no tissue to absorb the cold, if you get what I mean there. So even if it's a joint, apply the ice near the tissues or onto the tissues around the joint rather than directly on the bone. So that's the ice. Compression in the RICE protocol. This means that if there is swelling, compress the area, maybe with a wrap if it's a limb, and that will again reduce the amount of fluid that's going in, causing swelling. And the same thinking applies as with ice. Of course, the inflammatory response is something that may be helpful for healing, but if it's causing further pain and it's causing swelling that's self-aggravating, then compression may be helpful. In honesty, there's only so much you can do with compressing your own limbs. So the key thing I'd say is, if there's any bleeding, that's the time really that you want to wrap a tight bandage around an area to reduce the bleeding, whether it's a limb or anywhere else in your body. And then the fourth element of RICE, E for elevation. Again, if it's a limb, if it's swollen, then you can elevate. And when you're elevating, it's not just put a pillow under the limb, it means up like this. Okay, just think of gravity, think of what's going to maximize the drainage of unnecessary fluids down the limb. Again, similar thoughts apply as with ice, as with compression, but if you're in pain and the swelling's causing wider aggravation, then good to have that drain out of the limb. Preferably use something to hang the area up. Could be my arm, could be my leg, but allow it to hang. Obviously, don't try to keep it up with your muscle for hours on end, because that will be very tiring and you will probably end up with a strained muscle. So rest, ice, compression, elevation, and I hope you've got the feeling that this isn't a dogmatic black and white area. Use your judgment, use what feels right for you, use what feels right in your situation. Are you able to stay still? Are you needing to get on with things? How is your health otherwise? Now, I'd just like to throw in a few other thoughts as well. One is hydration. Make sure you're well hydrated, and that ensures that fluids keep going around. So whether it's fluids, maybe warm fluids, or isotonics, or simply water, make sure that you've got fluids in your body. If you can, light stretch. So if you do feel that a muscle's been injured, you don't want to give it a very big stretch, of course. You don't want to rip apart tissues that might be just starting to, or have just been injured and still need to heal. But a light stretch just to make sure that the surrounding area isn't getting drawn in, isn't going to spasm, that will be okay. Obviously, don't yank things around. So hydration, light stretch, and then self-massage as well. So it could be that an area has got a bit tender. Feel it with your fingers, press into it, and you can see with that, does it feel like good pain, which is a term I use a lot. If it does, then keep pressing in. Chances are that's doing good. Maybe it's just helping separate fibers that got slightly stuck together. Maybe it's allowing the wound to heal more easily than if it was all stuck together. So by a wound, I don't mean something that's bleeding. Obviously, you don't want to massage that, but something that feels like it's tender and good pain when you press it. And if it feels good, you can press a little harder with your fingers. Obviously, take care not to tense the rest of your body. And the important thing here is that obviously if it's bleeding or if it's inflamed, then you don't want to be pressing, because that's going to aggravate the inflammation, as I've described in previous sections. Finally, just a thought, the body is a remarkable organism, a remarkable instrument, millions of years of evolution. So studies have shown that staying positive actually helps the healing process. Revel in the wonder of your body, and of course go through the RICE protocol. And if that's still not healing nicely, then you may like to go and see someone, but try and stay positive. Think nice thoughts about your body and the wondrous healing processes, self-healing, that it has at its disposal. I hope you found that helpful. Thank you for listening. I look forward to seeing you in another video. Bye for now.